that their doctors prescribe for them leaves empty-handed because they can't afford the medication, especially for branded products. And part of the reason for this, it's unknown to a lot of Americans, but it's well recognized by the president and this administration, is that our drug prices are about 3 times higher on average than the same drugs made in the same facilities in the same American factories oftentimes than they are charging patients overseas in Europe, Asia, and other parts of the world. It's global freeloading. It's wrong. President demanded that we change it, and as most of you know, we spent much of last year negotiating with the 17 largest pharmaceutical companies that drive over 80% of the entire business in branded pharmaceuticals, and every single one of them agreed to a most favored nation drug pricing strategy, which simply stated means that these medications, especially going into the future, will be priced at the same amount as the rest of the world. It doesn't mean price fixing. We're not telling pharmaceutical companies what to charge. We're saying to them, whatever you charge us, you got to charge the other folks, which means we might be able to help you overseas to get better pricing so that you can make up some of the losses that you'll experience here. And the Council of Economic Advisors estimated that the benefit of the president's negotiated program is about $600 billion over the next 10 years, $600 billion of savings. The question then becomes, how do you actually get that savings to the American people? And we work together with some wonderful folks, Joe Gebbia and Korstein, who have been building the TrumpRx.gov site. And I've got an announcement that today we are adding 160 more drugs to this site. Now, the site already has 700 or so, or 600 or so drugs, so it's going to take it over 750 total. But that is an important number for other reasons. It means that 4 out of 5 medications that are picked up by Americans going into that same drugstore that I mentioned earlier now have the opportunity to double check that the price they're getting in that drugstore, wherever they're buying it from, is the best price out there. So it's a transparency site. It gives everybody the ability to make important decisions about medications they're purchasing with full knowledge of what the cost of those medications are. And that's important because transparency drives cost-effective changes in how we procure and consume products. You would never buy a car without knowing the cost of the car. Some of these medications cost what a car costs. And so these are important assets for the American people to have. I'll put some numbers on this. In the 2 weeks since we did the last event with the president on this topic, we're now up to about 12 million unique visitors to the site. Estimated savings are about $500 million, and again, climbing rapidly as more Americans learn about the program. And it is our great hope and belief that the average American, before they make a purchasing decision for a pharmaceutical product, will start using TrumpRx.gov as a standard, as a baseline, to take advantage of something that's been given to. Again, there's no money made from this site. The government does not charge money to people using this site. It's an opportunity for you to be empowered. That stated, I want to add to that one additional insight that some of you would like to hear, which is that starting on July 1st, the patients on beneficiaries on Medicare who are eligible for GLP products, the weight loss products that the president speaks of frequently, will be allowed to obtain those products for $50 a month. Now, the list price, as you know, for a lot of these drugs is well over $1,000 a month. We've been working hard to push down on these prices to make sure that these medications, which can be life-changing and even life-savings because of their impact on weight loss and downstream complications like diabetes and hypertension and all the things that they cause, like kidney failure and heart disease and strokes and dementia, even cancers, all those risk factors are going to be mitigated, we believe, if these medications are used correctly. And so when doctors prescribe them, Medicare beneficiaries will be able to obtain them for $50 a month. And we are hopeful that over the next few years, we will show an actual savings to the American taxpayer if these medications are used correctly and appropriately and consistently, so folks get the weight loss they desire with the downstream benefits that I mentioned earlier. I also want to touch briefly on the crushing of fraud, waste, and abuse made possible by the Vice President's anti-fraud task force. The White House task force has been aggressively going after an all-of-government approach. I'll speak personally as the person charged with the Medicare and Medicaid services. When we identify, by looking at the data, which we have plenty of, that there's an aberrancy in how these bills are coming into us, so there might be fraud there, it's incredibly empowering for us to quickly call the Office of Inspector General or the FBI, the Department of Justice, and to have Todd Blanche call back and say, here's what we're going to do about what you just observed, or call Scott Bessent at Treasury and say, we need forensic accounting. Something is going on here. Where are they hiding the money? And I want to emphasize that this is sophisticated work because our opponents are extraordinarily sophisticated in their attacks on our system. They just need to have a Medicare beneficiary number or some of their ID, which is basically a credit card, and they can begin charging against the federal tax dollars that go into Medicare and Medicaid. That's one of the reasons we're seeing such high amounts of fraud in different parts of the country, and we believe there are organized criminal groups behind some of these endeavors. So I wanted to walk you through a couple of these examples, because our goal is to stop the money from ever leaving the building. That is the best way to protect the American taxpayer. As you know, we were in Minnesota last week, where the largest autism takedown occurred. A mother and a daughter, adult daughter, were accused of tens of millions of dollars of theft. Just to put this in perspective, the reason these are so important is if you defraud the system, you don't just take money out of the system. People steal your money. The money from our most vulnerable Americans are going to steal their health. They'll steal their life. And that's what we have been seeing in some of these takedowns. Unfortunately, when these events don't happen in a timely fashion, you lose the whole program. So in Minnesota, the state itself stopped non-emergency medical transportation, which is when you need someone to take you to the doctor's appointment. They cut the whole program. It's gone. It's finished. Because they could not deal with the fraud. It went from an estimated $1 million a year, how much can it cost to take a card to a doctor's office, to over $100 million a year, so they killed the program. And that, of course, we believe, because it doesn't provide the kind of care we desire for our fellow Americans, can be problematic. We don't want that to happen in other endeavors as well. So we've been working with the state of Minnesota. We're not happy with some of the things we've been encountering as we look at their receipts on the services they provided, which is why we deferred $350 million to the state of Minnesota, and we're waiting to hear feedback from them. Other states have also been problematic. California comes to mind, where we've made several trips of late. 1/3 of all of the hospice in the entire country. And hospice is a precious, beautiful program built in the 80s to take care of people with dignity in the last months of their life. Classically, someone has metastatic cancer, they're going to die. It's going to happen in a few months. You give up your Medicare, because why would you want Medicare? You don't need all those things. Take hospice instead. But that trade has risks with it if you don't actually have a lethal problem. And when 1/3 of all the hospices in the entire country are in Los Angeles, not even California, and Los Angeles, that creates issues. First of all, it's not plausible, but it also means someone's been ignoring the problem. And in fact, there was a call 4 years ago by the state auditor in California to address these problems. It was not managed. So our agency has now suspended payments to 850, almost half of all the hospices in California now have been suspended, but they're no longer being paid. And we're going to keep aggressively going at this problem, because when we go after hospice in California, guess what happens? Hospice in Nevada went up 7-fold. Hospice in Arizona, hospice in Texas, they've all gone up. These scoundrels run to other areas. I just learned this morning, now they're infiltrating the home health care space in California, which is equally a problem, because now they're taking advantage of a different sector of the population, this time Medicaid, but using nefarious techniques and technologies to do that as well. And again, these are organized criminal syndicates, we believe, in many instances. And that's why being a personal care service attendant, which is, again, doing something that your family would normally do for you, carrying groceries upstairs, driving you somewhere, that job is now by twofold the most common job in California, and it's the most common job in New York. Again, this defies belief that you can get that much growth in single sectors, but these are well-paid jobs that have become now ubiquitously available. There's not been strong guardrails. The last administration did not think that this was an important endpoint. The endpoint was enrolling people and getting people onto these different programs, and that has led to a tremendous opportunity for corrupting the system, and that's what we're witnessing. With that in mind, there's lots we can do to fix these problems. We've been aggressively going after states, red and blue. We wrote a letter to Florida. The difference, by the way, was Florida responded by saying, we know we have a problem. We're going to double down. We want a moratorium on all of our durable medical equipment suppliers. And why? Because there are twice as many durable medical equipment suppliers in South Florida than McDonald's. Again, not really possible unless you're looking the other way. We're not looking the other way. We're aggressively taking on these challenges. And I'm going to reemphasize something that I'm hoping everyone appreciates. But if you're defrauding our most vulnerable citizens,